something else is making cataract surgery safer and easier. 7's Diana Diaz shows us how a new laser is helping those who are out of sight.
Clayton Whitehouse knew something was wrong with his vision when everything started to go dim.
Something as close as the keyboard. I would even sometimes need a flashlight to identify where the keys were. I used a magnifying glass when no one was around because I was pretty embarrassed that, even some of the larger print I couldn't see.
The 53-year-old just chalked it up to aging, but it turns out a cataract in his right eye was causing all the problems.
So it's like looking through wax paper. It's just very cloudy.
Clayton wasn't looking forward to surgery. All he could remember is what his grandmother went through many years ago.
The eye patches, the gauze on the eyes, almost being blind through the recovery of it.
But a lot has changed since then. For the first time, cataract surgery is now being done with a laser similar to LenSx eye surgery.
I think when most people think about cataract surgery, they think about their parents or their grandparents in the 70s and 80s. And we're seeing a movement toward younger and younger patients in that the surgeries have become much safer, much more accurate.
Doctors at SightTrust Eye Institute in Sunrise are one of the first in South Florida to use the LenSx Laser. Instead of using a blade, doctors now let the laser do all the work.
I want you to stare right in the center of that circle of light. We used to have to do this with our hands, and it was never as accurate. This is so much easier.
Doctors also say the laser makes the procedure safer.
And the reason we feel it's safer is because when we used to use ultrasound to break apart the cataract, now we no longer have to do that. We're using a laser to divide it. It's much more gentle, there's less energy in the eye, so you get less swelling. Go ahead and apply and treat.
The other breakthrough is once the cataract is removed, there are new lenses which help patients see both near and far.
We can now be much more precise when we tell a patient you're going to see almost perfect, if you will, from far to near. Now what we're going to do is remove that cataract and replace it with the implant that will be there for the rest of his life.
Clayton had the quick and painless surgery.
You're good as new. Look at those new leaves on all the trees that you didn't know were there.
By that night, he was seeing like a young person again.
It was like someone turned the lights on. The world looked brighter. I can use the computer now. I can read books again.
You'll need a thorough consultation to make sure you're a candidate for this type of surgery. If you'd like more information, you can log on to our website at WSVN.com and click on Medical. In the Plex, I'm Diana Diaz, 7 News.